Hi, everybody. Welcome to Melanoma Matters. I'm Sapna Patel.
And I'm James Larkin. Hi.
We are live from ASCO 2026. Hard to find a quiet spot here, right? Do you want to tell people where we are? They can come find us.
Yeah, fairly high up, right by an escalator, just
South
above the main
building,
concourse.
5th floor.
It's pretty noisy.
Yeah, it's noisy. So sorry if you hear this escalator. But yes, we're at ASCO. Yeah, I mean, we're not saying it, but people noticed whose badge is longer there. It's because mine was shorter at ASCO. You had the longer badge. Anyway, melanoma sessions are not over yet. In fact, our oral session and our clinical science symposium is tomorrow. So there were some abstracts we just wanted to highlight that we're looking forward to hearing the results of. Optimum O2
In uveal melanoma.
metastatic uveal frontline should be practice-changing abstract presented by Marlena Orloff. So we're excited to see that. The ATOM trial, adjuvant avelumab for Merkel cell. So nice to see kind of the third of this anti-PD-1, anti-PD-L1 space in Merkel. Let's see if there's a different signal or if the signal's consistent. That's presented by Shailander Bhatia, phase 3 study. So good to see those can be done in these rare tumors. And
Keynote 942.
sure, we should give Keynote 942 some props. We're going to see the 5-year outcome of the phase 2. I think everybody wants to see the results of the Interpath 001 phase 3. Ultimately, that's going to be our practice-changing study. But let's see if the benefit of personalized cancer vaccines is maintained in the adjuvant setting at 5 years.
And that's Matt Carlino.
Matt Carlino, exactly. Anything else you're looking forward to in that session?
Well, we were going to mention a couple of neoadjuvant pilot studies, right?
Yeah.
They're in that session.
Yeah.
So one of them is the one that Georgina Long's been talking about, which is called Neo
Rennie.
Not Rennie. Not Neo Brian Rennie. Neo Rennie.
Shout out to Brian Rennie. Hashtag your amigos. We can get more followers that way.
So that's all about thick primaries, I think, isn't it? And taking some, leaving some, basically, giving Nivorella
For clinical stage 2, yeah.
And then trying to judge path response. So that's interesting.
Yeah, it's going to be a good one to see the results of.
Yeah. And the other one was cemiplimab, I think.
It's triplet therapy
triplet.
in the neoadjuvant setting. So it's IPI, Nivo, Rella, neoadjuvant.
Yeah.
Yeah.
And
It's a pilot
that's
study. Let's see.
Amatorini. Yeah. Very good.
And then I can't wait to see my pal Chris Barker give updates on the other Rampart trial. Whose Rampart trial was bigger, do you think? What his Rampart trial is?
No.
Response-directed adjuvant radiation in squame, I think.
Okay. And how big? Do you know?
Well, why don't you tell us about the other Rampart trial? Congratulations, by the way, on your oral presentation.
Yeah, so yesterday I presented the durvalumab monotherapy arm of Rampart, which is an adjuvant kidney academic investigator led trial in adjuvant kidney cancer. And long story short, the hazard ratio was sort of 0.7. But we only ended up randomising about 800 patients, so it wasn't statistically significant. We had aimed to randomise 1,750, but COVID kind of got in the way, in the UK at least.
Well, despite all of that, yours is bigger.
Okay.
The Rampart trial in squamous cell is not 800.
The other Rampart.
The other Rampart is not as sizable. Yeah.
Okay.
But well done on that presentation, by the way.
Thank you.
Yeah.
Team effort.
Yeah, it's funny to have an ASCO with 2 Ramparts, though.
Yeah.
And then we had mini orals yesterday. Congratulations to all those presenters. We look forward to kind of going through those in a little bit more detail. Detail, if that's what you would say it. Detail. And, future podcast episode to maybe unpack a handful of those, a couple of those. So, and good luck to the clinical science symposium speakers, cell therapy. There's a couple of cell therapy abstracts tomorrow in the orals, kind of more patients or additional data from stuff you've heard before, Obsidian, OBX115, Anzacell.
Exciting.
Yeah, good time. So,
Okay.
okay, so we're going to do a Best of ASCO podcast, we promise.
Best of ASCO
2026.
2026.
Wait, and how have we been saying it? Best of. Yeah.
Best of ASCO colon 2026.
I think that's it. There was a punctuation I couldn't remember.
Yeah.
So stay tuned. We'll record that hopefully in the next couple of weeks and get that out to you guys. So
Okay.
thanks everybody. Hope you had a good ASCO.
Bye.
Bye.